Good evening. I want to make sure everybody can hear me okay. So before I keep going, if somebody could write in the Q&A or the chat section that you can hear me speaking right now. So I'm Josh Goodwin. I'm the doctor here at the Regenexx Las Vegas clinic. I'll be the one going through the webinar tonight, just talking about what we do, who I am, who Regenexx is, and this webinar is more of our kind of introduction webinar as far as what we do, and trying to give you guys a sense of how we make decisions here in regards to the procedures, who's a good candidate, and how we come to that decision. The webinar itself doesn't have a lot in the way of specifics for outcomes for each individual joint. Obviously, people can ask questions. So those little Q&A and chat sections that you guys wrote in, a couple of you, you guys can put questions there throughout the presentation. And at the end, we have a dedicated Q&A time where I can get to those questions and answer them to the best of my ability. So if you guys want to jot them down there so you don't forget the questions as we move forward, then I'll make sure to run through those before we finish tonight. The whole goal of this webinar is just education, just trying to get the word out there as far as different types of procedures and different types of interventions for orthopedic problems. So everything we focus on here at Regenexx Las Vegas is orthopedic conditions. And so that's what we're going to really be speaking about mainly tonight. So hopefully you're here for that. Like I said, just want to educate people and provide a format for people to have a platform to get out and to learn about maybe new and evolving treatment choices to help treat orthopedic problems. And we'll try to make sure we get through this efficiently and then get to the Q&A time, which I feel where people get probably the most benefit. But I might answer some questions as we move along here. So just a little bit about my background. So as I said, my name is Josh Goodwin. I'm a medical doctor. I did my medical school training at the University of New Mexico. That's where I grew up, and I went to high school, and I ended up staying there for medical school. I did move to Texas for my residency training in physical medicine and rehabilitation. So this is a non-surgical field where we focus on helping restore pain and like reduce pain and restore function. So we do a lot of training with orthopedic injuries. We do to the other end of the spectrum, like traumatic brain injuries and amputations and spinal cord injury as well. I'm fellowship trained in sports medicine and interventional spine. I'm board certified in physical medicine and rehabilitation. I've been with Regenexx, which we'll talk more about what is Regenexx and how long has it been around. Since 2015, I performed many Regenexx procedures on patients, trying to help preserve people's joints and orthopedic tissue and help prevent surgery. And I'm a co-author on a review article for using stem cells for low back pain and disc degeneration. So that's just a little bit about myself. And as I mentioned, we're here to really talk about different types of treatment options for orthopedic problems. So things that affect your muscles, your bones, your joints, your ligaments, your spine tissues like disc, nerve, and joints of the spine. And these types of tissues can be injured or become problematic for many different reasons, like degeneration, overuse, inflammation, injury. And they really affect people of all ages, from young to old. And we all obviously have dealt with these issues or know somebody that has. They're very costly conditions in regards to treating, both direct and indirect costs. And again, most people know somebody that's had a muscle, bone, tendon, joint, spine issue. And most of us are going to be familiar with the more traditional treatment options, which include over-the-counter medications or prescription anti-inflammatories, physical therapy, bracing, cortisone or steroid injections, and surgery, right? People will go through these different types of paths for treatment to try to help improve pain or function related to orthopedic problems. And these can be helpful. They do help patients, but they also come with their own set of risks and complications and their failures. And again, we're going to learn about different options as far as the evolution of medicine and what are some different options to maybe help prevent the need for some of these things. So even simple things like taking a Motrin or an ibuprofen carries risk, right? So those types of medications are associated with death every year. So there's a mortality rate. There's people that have issues with stomach ulcers and bleeding, kidney problems, increased blood pressure, increased risk for heart attack and stroke. And so these aren't benign, even though they're one of the most commonly prescribed medications for joint pain and arthritis, but they do come with risk. So we got to think about that with prolonged use. Then we have to think of, other options that people sometimes get to the end of the road, and the more traditional things like steroid injections, and those things haven't helped. Steroid injections, which I don't have really a slide for right here, come with its own host of issues. And if you've ever had one before, sometimes the doctors will tell you, well, we can only do this for 2 to 3 times a year. And that's because the exposure to cortisone or those steroid medications, whether it be oral or injectable, carry risk. They're toxic to your tissue. They can create breakdown of your cartilage. They can weaken your bone. They can weaken tendon. And so the more you're exposed to those things, the worse off you'll be down the road. You might feel good for a period of time, typically weeks to months, and then they start to wear off. They become less effective as your joint or your tissue degenerates more. And so that we have to think about that in regards to exposing our bodies to these different types of treatments. And then obviously we have things like surgery and some of the risks and complications that come from, say, a knee scope, where they put cameras in and maybe fix a meniscal tear or something, up to a 5% complication rate. Knee replacements, up to 16% complication rate, including death, infection, blood clots, revision surgeries, loosening of the device. And then we have to remember that even surgery is not a fix for all problems, right? Every treatment option has a success and a failure. And the more invasive a surgery is, the more exposure to potential complications there is, right? So always things we have to keep in mind. So for example, with knee replacements, only 40% of people get back to full activity. Usually around 20% of people, up to 30% of people still have pain post knee replacement that's rated as a moderate type pain. And so we have to think about these things going into them. And you can walk through the different parts of the body with lumbar or spine fusions and the complications of that being in the 20+%, and people still with pain after. Rotator cuff repair, which can be successful, but carries some different type of risk with significant downtime and discomfort. But if there's other less invasive options, it makes a lot of sense to try to help do those things. And just as a comparison, some of the injections and treatments that we provide, if we look at the potential for serious adverse events, we did a study looking at 2,300 patients over about a 10-year time frame with only a risk and complication rate of about 0.17. So that compared to 5 or 16% for some of these other surgical options, it's significantly less potential and exposure to risk. So these are just things to think about. You know, what's the risk of taking ibuprofen every day for 6 months or a year or 2 years? What is that going to do? How many times can I get a cortisone injection without creating a detrimental long-term outcome and accelerate my arthritis, accelerate my degeneration of my tissue? Or if I'm in that phase where maybe I might need a surgery, what's the exposure to the risk? What can happen if things don't go right? And it's good to know those things before jumping into these different options. And that's where we kind of fit in, I feel like. Regenexx has been around since 2005 as a whole. It started in Colorado with Dr. Centeno and Dr. Schultz being a little tired of this merry-go-round of cortisone injections and sending people to surgery and then coming back with pain and continuing what you were doing before. And there was a lot more research on using stem cells and PRP for orthopedic problems. And so Regenexx grew out of that. So we have about 60 plus clinics around the world. We have some international clinics and a lot throughout the US. We're just one of all of these different providers. We're obviously here in Nevada and Regenexx Las Vegas. And since the beginning in 2005, we've always had this focus and this kind of philosophy to kind of innovate first, figure out what we need to do, and perform clinical research on patients, and then track those patients in a registry, which we're going to talk a lot more about in regards to how we start to predict who's going to be a good candidate or not for the things that we do. And then we use this to help guide our treatment options. So we have access to the outcomes, complications, failures of all of our treatments, and that helps us decide in the future who we should treat or who we shouldn't. And then we always publish a lot of research on a yearly basis, and that's useful for not only our organization, but people around the world as well. And really, this is just the evolution of medicine and kind of creating a new field to try to help treat orthopedic issues and try to prevent surgery and help preserve the joints. And so basically, we call this interventional orthopedics. This is where we use injection procedures, so just needles to target these different tissues in our joints or spine to help facilitate healing or reduction of inflammation or improve support to that area to help improve healing, reduce pain, and reduce inflammation. And our goal is just to preserve tissue and hopefully reduce the downtime and risk compared to those more invasive surgeries, which is always good for everybody. The less surgeries we can do on patients, then the more money we save and the less exposure to risks and complications. And so some of the things that we treat or that we use to treat are called orthobiologics. That's kind of a generic term for what we're going to talk about in regards to the procedures. And so we have to have a little basic understanding about what our bodies go through for healing. We all understand that our bodies have a capacity for healing. And maybe you haven't thought about it that much because you just let nature take its course, but we've all had cuts on our finger somewhere in our body, and we've grown new skin. How did that happen? What was involved with initiating that healing response? People have had or have known people with fractures. And guess what? Most fractures heal. Now, some need surgery to be stabilized, but after that, your body still has to heal the defect in the bone. And so what's involved with helping stimulate that response? And all of these different factors can be found in your body. Your body always wants to maintain some sort of balance and homeostasis. So we get things that create inflammation, we need things to help reduce that. If we get things that get injured, we have to have ways to stimulate repair in those areas so that we don't break down and that we can live and continue to function over years. And so there's going to be things we talk about that can be isolated from your blood. There can be things isolated from your bone marrow, and we can take advantage of these different healing or regenerative components of our body and take advantage of their properties, and then use them in other areas that maybe have some issue with healing or inflammation or degeneration. And so one type of cell that we use are called platelets. Some of you may know what platelets are, some of you may not. This is one type of cell found within our blood. So it can be extracted through a blood draw. And in our lab, we can isolate and concentrate this. When you isolate and concentrate platelets, this is called PRP, platelet-rich plasma. But platelets help, basically, I like to say they're like the first responders to injury. They're the activators of healing. And so if we look at components found inside the platelets, these are the different growth factors that get released. And it's these growth factors that help stimulate different aspects of healing. So we have growth factors that stimulate cell growth, collagen production, growth of new vessels, tissue repair, hyaluronic acid production, cell growth, wound healing, and same thing here. So these growth factors can directly stimulate for healing and growth. And then we have some that can provide building blocks with the collagen, and some that can improve blood supply to an area. And this can be very helpful, as we're going to see some of the data that we can use platelets to help treat mild to moderate arthritis, tendinitis, bursitis, small tears, and soft tissue. So these tend to be really helpful for the more mild to moderate ranges, small tears, inflammation, tissue that gets irritated and inflamed from overuse, those kind of things. And this can be very effective. Now, again, it's not the right tool for everybody. And we're going to talk a little bit more about that in a bit, about the process that we go through in trying to figure out who's a good candidate for these kind of treatments. There's other proteins in our blood that can be used to help kind of create that balance again. If we get tipped into too much inflammation and the scale is being tipped into that direction, we want to help set that back so we can get in a more healthy joint environment, which can help a lot with pain. And so this is isolated from your blood, and you can actually extract this and inject it into joints that have arthritis with a lot of inflammation and swelling. And this can be helpful for protecting cartilage and reducing that inflammatory response. And then we can also isolate cells from the bone marrow. The bone marrow is a host to lots of different types of cells, some of them called hematopoietic stem cells that make your blood. Mesenchymal cells can be, at least in the lab, they show us that these can help with kind of transform and help with muscle, bone, nerve, cartilage type maintenance and improvement and improving the health. Again, they're involved with maintaining that balance and homeostasis to help improve healing and maintenance of tissue. And so these have a little more potential in regards to the healing stimulation and kind of keeping a joint environment or a soft tissue environment a little bit healthier. And we tend to use these for more moderate to severe conditions, tissues that have a little bit bigger tears, or if we've done some PRP, those platelet treatments, and people are only getting short-term improvement, we can take a step up and do treatment with bone marrow concentrate, is what we call it, and inject that into these different areas, whether it be your shoulder, your knee, your back, your hip, your toe, your finger, whatever it is. We can try to target some of these tissues to help kind of, again, improve the strength and the health and improve pain and function at the same time. And so we always like to just highlight that there's been a big growth of research in regards to using orthopedic cellular therapies for orthopedic conditions. And so kind of some of the initial studies will go back to the late 90s. And then since then, there's been kind of an explosion of studies throughout the years. There's probably even more now. There's been some that are getting published all the time. And so there's definitely data out there for bone marrow. This is just a list of some randomized controlled high-level studies looking at platelets for different parts of the body compared to these other more traditional treatments that people get already. So for example, knee arthritis getting treated with platelets versus gel, platelets versus exercise versus medications versus saline versus steroid injections, shoulder, carpal tunnel, spine issues. So there is studies out there looking at the efficacy and safety of these different treatments. Again, for knee arthritis. And so it's just important to recognize that it's not like this hasn't been around for a long time. It's been used a lot. Again, as an organization, Regenexx, if you take into account all clinics, has treated more than 150,000 patients since 2005. Roughly 40,000 of those patients are in our registry that we're currently tracking. So this is not brand new. We have lots of data on it. And basically we use that data to kind of go through these little steps here to determine if this would be a good option for you guys. So basically we have 3 steps. We have to have the prediction process. Then we have to, if we decide to do a procedure, we have to have the right ability to be able to extract those cells to use for the different problem. That's a very important step. And then we have to be able to deliver those cells to the right area. And as I mentioned, we only focus on orthopedic problems. So spine issues, shoulder, elbow, wrist, hand, hip, knee, and foot and ankle. You can get arthritis in these areas. You can have disc bulges and nerve irritation, labral tears, rotator cuff tears, elbow arthritis, golfer and tennis elbow, wrist arthritis, thumb arthritis, carpal tunnel, labral tears in the hip joint arthritis or tendon issues, meniscus, ACL, or ligament tears and arthritis of the knee, plantar fasciitis, and arthritis of the foot and ankle, tendonitis. These are all things that we see and treat on a daily basis. So if we look more into the prediction process, we do a new patient evaluation. Obviously, we are guided by the patients that have been treated in the past, so we understand what the success rates are. And then again, we're always publishing data on those outcomes. And so our new patient evaluation process is very important. Remember, if you ever see somebody for any type of medical treatment, if they don't do an evaluation, they don't ask you questions about your problem, they don't look at imaging or your past medical history or those kind of things, and they just say, yep, we can do something for you, definitely run, because you have to understand what you're treating to see if what their options are is going to be right for you. Are you going to be a good candidate for those types of treatments? And so all of our consultations get at least an hour. We review medical history. We go over in depth the medical imaging, MRI, CT scans, ultrasound, X-ray. We always do a physical exam, and we discuss all options. That may just be physical therapy, that may be surgery, or that may be what we do with the Regenexx procedures. Again, we go over imaging and review. And this is really more there to help educate you on your problem. Because if you don't know what's going on, how can you best decide what treatments to pursue? And so as an example, this is our registry data. This is a little bit old. We have a lot more patients, I think close to 12 or 13,000 in our knee outcome data. But this is what you can do. You can go to regenexx.com and you can look at these different areas to look at outcomes from time of procedure up to 4 years and the different conditions. Again, also here, you can look up our published research. and then our clinical studies that are ongoing. And that whole process is to help us decide, are you a high responder candidate, a moderate, or a low responder? There's different success rates that correspond with these different levels. And this is determined by your imaging and physical exam. And every part of the body can have its own specific characteristics by which we look at to help determine your chance for success. So it's hard for me to say. People will ask, well, what's the success rate? Well, it depends. What joint is it? What's going on there? How much cartilage is left? How big is the tear? How big is a disc bulge or herniation? Do you have space to get into the spine regions? And so there's a lot of variability in each part of the body to determine success. And so it's really determined by kind of a full evaluation and imaging and going over that. But for example, if somebody was a candidate for a bone marrow or a PRP, a platelet procedure, there's the other part that is very important, which is the lab processing. And so we have a lab platform. We have custom treatments based on your specific problem, and dose matters. No matter what they say, dose matters. And so the flexible lab platform is very helpful for creating customized concentrations of products based on your age, the injury severity, the location, the tissue. Your disc is different than your hip, different than your tendon. And so you got to be able to customize the concentrations of these different cells to maximize benefit. A 15-year-old needs something different than an 80-year-old. We can make different products at the same time. So if one area needs bone marrow, the other area needs platelets or A2M, we can do that all in one setting. And so this really helps kind of create a more customized treatment option compared to a lot of orthopedic places that just have a bedside centrifuge that pumps out a one-size-fits-all approach for their patients. And then once you get those good cells and you get the right concentration, you have to be able to deliver it to the right area, right? So you have to use image guidance. This is an X-ray showing the procedure going on, and then using the pre-procedure MRI to identify, in this person, arthritic change behind the kneecap and a little bone injury inside the kneecap. Or use an X-ray to help treat the labral tear or the joint space. Or use ultrasound to insert a needle and what we call hydrodissect around the carpal tunnel nerve for carpal tunnel syndrome. You got to be able to see these things to deliver them to the right area safely. This is a 30 gauge needle here. So this is a very small needle. So obviously less invasive than a carpal tunnel surgery where they have to make an incision and make a cut here where you have a scar and those kind of things. And so these three steps are kind of what make the Regenexx difference. Our prediction process by tracking patients over years, our comprehensive evaluation, the flexible lab platform, and then precisely delivering the solutions to the problem areas. Again, just more data showing that we track patient outcomes. This is more specifically for knees on this one. This was almost 50,000 surveys looking at conversion of patients to surgery. And so at 48 months, around 7% of people still got surgery, but there was a lot of people that avoided it. So those are just things that we do to kind of keep track of how our procedures are helping. For the platelet procedure, we actually call it SCP instead of PRP. It just stands for super concentrated platelets, since we can elevate them a lot higher than those bedside centrifuge machines. This is a one-day procedure. Blood draw takes 10-15 minutes. Processing takes about an hour and a half. And then we have to re-inject it. Again, image guidance into the tissue areas directly that we need to treat. You can treat more than one area at the same time if needed. There can be about 2 to 3 days of some pain and inflammation, where you need to kind of protect the area. Low impact exercise for a couple weeks. Some people need bracing, some people need physical therapy. And some people over time need more than one treatment. So not everybody gets cured or improved with one treatment. These aren't necessarily cures for arthritis, but they can help manage and maintain that tissue and help people be more functional. But everybody's situation is different, so it's hard to say how many treatments you might need versus the next person. But again, we go through the process to figure out. We tend to use these types of treatments for, again, mild to moderate arthritis, tendonitis, bursitis, inflammatory conditions, small tears, and soft tissue, and a lot of spine procedures and those kind of things. The Regenexx bone marrow concentrate protocol for joints has 3 steps to it. We do a little pre-injection, so it's a little more involved. This helps stimulate a healing response with something called prolotherapy. It's a pro-inflammatory response to initiate the healing cascade. And then the 2 days after that, we do a stem cell treatment. And again, we isolate it from your bone marrow. We get it from the back of the pelvis. It takes about 30 minutes. We can use, obviously we use numbing medication. We can use IV anesthesia as well. And then we inject the same day. The big issue with this is we're not allowed, based on FDA, to grow your stem cells or some of the bone marrow cells to higher levels. We can only extract and concentrate them. And so that's called minimal manipulation. And so we can do that process as part of a same-day procedure, but we can't grow them. And because of that, as I mentioned, dose matters. Most people can only treat up to 2 different joints with this process at one time. If you have 3 or 4, won't be able to treat them with this process in a single visit. You might have to do another visit in the future. And then to kind of complete the process for arthritic joints, there's a post-injection, which is kind of what we call like a fertilizer injection. And that's where we use platelets to help continue to boost the healing response to that area. So some things about stem cells, as I mentioned, you need to have a process by which you evaluate people's candidacy. Not everybody's a good candidate. All medical procedures have successes and failures. And so you have to understand that before making decisions. And so we're not seeing that people can just regrow whole new cartilage and go from a bone-on-bone joint to a normal joint. It doesn't happen yet. Maybe we'll get there in the future, but not now. We do have to remember that stem cell and different types of cellular therapies are regulated by the FDA. And there's only certain ones that are allowed. Many people using umbilical cord products, which we don't use because of FDA regulations, lack of studies and safety. These are not actually allowed by the FDA. They're basically being used kind of as an illegal form of a medication, and many people have been sent letters and shut down. We've tested these different products, comparing umbilical cord products found in the United States, which is different than outside the United States, compared to taking stem cells from people's bone marrow and showing growth from our live patients versus umbilical cord, which is all dead tissue. So if you're going to get an umbilical cord product in the US, you're getting basically dead cells with some growth factors. The growth factors could potentially be helpful, but there's some question into regards to the health of the cells when you get them. There's been some recalls a couple years ago, and just a lot more limited studies in humans. The only studies available are outside the United States, and they're not using the type of products that are available in the US. So we don't really use these at this point because of the legalities. There's not a lot of standardization. There's not much human research. So again, we're using more your own tissues. That's called autologous treatments, where we take them from your own body, isolate them, concentrate them, and inject them into areas that need some assistance and improvement and healing. So we moved through that pretty quickly, a lot of talking. I just want to give you guys a chance to Somebody's saying that they can't hear me. Are you guys able to hear still? Yeah, so some people are saying they can hear me, so it might be your end where the sound's not clear. So you might want to check your own audio. Dorit, you might want to check your own audio because everybody else is saying they can hear me okay. So I just want to open it up to questions so people can write in the Q&A or the chat area if you have any specific questions. As I mentioned, everything here is orthopedic based. We're basically non-surgical in nature. We're taking advantage of our own intrinsic healing capacity, isolating cells that have been shown to help improve healing, reduce inflammation, stimulate blood flow, stimulate strengthening of tissue so that people can be more functional. And the whole goal is joint preservation, whether it be in the spine, knee, hip, shoulder, thumb. We're trying to do what we can to preserve the tissue. And we're trying to be that bridge before people need to transition on to surgery. Sometimes surgery is the right option, but oftentimes it's not. If you look at orthopedic studies, there's probably around 70% of orthopedic surgeries that likely don't need to happen as they currently are. And so there's a lot that we can probably help prevent if we can catch people on the right time. Most people will ask, these procedures are not covered by insurance. Unless Regenexx is the only organization that has any insurance coverage for these types of procedures. We work with about over 500 companies that have added us as the provider for these types of therapies. So there's more than 10 to 12 million people covered through their employer. So if you have a question about that, you might want to ask your employer, especially if they're self-insured. So most of them for outside that are cash pay. So they can range from $1,000 up to $6,000 to $7,000 depending on what you needed. So I can't give you an exact cost unless we knew exactly your situation, how many tissues needed to be treated, did we need bone marrow or platelets, and so that can kind of vary. We do have a question about having a platelet dysfunction identified by a university, and that they have a lumbar fusion that never fused. In 2016, they stripped the myelin sheath that has the left leg L3 severely affected. Can we do stem cell spinal injections in the United States? Can I get an evaluation via Teledoc, Zoom? Once I send my records. Your closest facility is Las Vegas. I'm not looking for a significant hope. Okay. So yeah, yeah, depending on what the platelet dysfunction is, I'm not sure exactly if it's just kind of an adherence type issue, or they don't clump together, or what the specific issue is. But yeah, some people with underlying platelet disorders sometimes have a reduced ability to heal. And so it may not be the best option. It'd probably be helpful for us to understand exactly what that condition is or what the dysfunction is, so that we can, have a better sense of how to educate you on how that affects these types of procedures. We do inject bone marrow concentrate cells, so those mesenchymal cells found within the bone marrow that contains those mesenchymal stem cells. We do inject those in the spine. So depending on the significance of what's going on, we would need to evaluate your MRI or CT scans to look at the exact structure to make sure we can get to where we need it to see if we can provide some benefit in that way. But it is possible to do those types of injections in the spine in the United States. What we cannot do in the United States is take your cells and grow them over weeks to kind of amplify the dose and then inject them. We can't do that. That can only be done outside the United States. And we do like Zoom telemedicine consultations, as long as we have updated imaging within the past 12 months. So for spines, that would need to be an MRI and or CT scan. MRI better for the nerve issues. CT scan can see a little bit better sometimes if it's not fusing. So there's definitely some ability for us to look at that imaging, discuss with things over a Zoom or a telemedicine visit to try to get a better sense of things and to walk through what the potential for improving your situation is. So this information on the screen here can be a good way to get your information to us. So Melissa Wright, also Lauren, I'll have to update this. So we have some different people that help with our education center, but you can use this for now, and you can call this number if you want to help find a way to get the information to us so that we can schedule a telemedicine consultation once I have a chance to review the imaging. For other people, if they ever want to figure out if they're even a candidate to even talk to us, is it worth your time? We do free MRI reviews to see, is it even worthwhile having a consultation? And so you can also use this contact information to get that information to us as well. So we do that as a benefit to people trying to figure out if it's worthwhile coming into the clinic to get a more formal evaluation. So no other questions right now from anybody that's still watching, but some people will ask about complications and kind of risks. Really, there's no added risk to injecting PRP or bone marrow cells. The risk comes from injecting needles into different tissues. So if you've had a cortisone into the knee, the same risk you expose yourself to with getting that needle poked into your skin is the same risk that you have here. Now, these types of cellular injections do create a healing response. So people can get a little short-term swelling and inflammation and stiffness for about a couple days. Sometimes it lasts a little bit longer depending on what we're injecting. Like a disc injection in the spine or a rotator cuff or a plantar fascial injection can be a little bit tender for a little bit longer. Again, some people need bracing, some people need more significant physical therapy. If you have a big tear in a tissue that we're trying to get to heal, you might need a brace or a sling, or you might need to have more restrictions. So every case is a little bit different. I guess the big take-home message is that there are different options for orthopedic problems. Your option may not just be surgery, it may be something else. And so that's really just what we're trying to do, is provide that ability and education to allow people to maybe explore different options if they've been told they need surgery, or they just need to keep getting cortisone injections or something, or maybe something else that can be a little bit more effective. Well, as I mentioned, reach out to Melissa in the education center if there's other questions. Do injections help dystonia? That's a question that we just received. No, I haven't had much success or any data on helping dystonia. So I would say that probably not. Sometimes you can help if there's kind of a nerve injury that led to some of that, but I haven't had much success. There's been some other patients that came in with similar issues like that, but it hasn't helped all that much for those kind of things. You can try to treat the muscle and the nerve, but I haven't had much results, and there's not much data on how much it helps that condition. So yeah, we will post a recording. There, we do have some other recordings of our others. We do kind of a general overview seminar like this one. We have a specific one for knees and spine, and we'll make some for other conditions like shoulder and other parts of the body. We will post them to our website at regenexlasvegas.com shortly. That's probably the best way. Or if you want a recording kind of emailed to you, you can get a hold of the number here, and that can be sent out as well. So we have a question, do we do anything for neuropathy? So it kind of depends. We've treated some very focal neuropathy in the lower extremities. As I mentioned, we have had some success with carpal tunnel syndrome, which is a type of neuropathy. Kind of diffuse peripheral neuropathy related to aging or diabetes or chemotherapy or hormone dysfunction. There's not a lot of data on there for that. We've done some platelet and growth factor treatments around nerves for very focal neuropathy, like an injury that led to a nerve injury, like a fracture led to a nerve injury or something. We've had some success with that. But peripheral neuropathy has been more mixed. I've tried to use these types of therapies for that, and I would say it's more 50-50 in how much it helps. We've had about half the patients get noticeable significant benefit in some of their burning and kind of pain symptoms, but it doesn't completely reverse some of the numbness that can come along with it. So there can be some limitations depending on the severity and the cause of it. I don't see any other questions at the moment. Again, we're always here if questions come up. I would definitely reach out to this email or this phone number if there's ever a time you want to get in, or even get your information or imaging sent in. We like imaging within 12 months. In the clinic, we do have diagnostic ultrasound, but we don't have our own MRI, so we typically have to send out for that. Not everything needs an MRI. Spines definitely do. Sometimes knees, sometimes hips, sometimes shoulder, depending on the problem. So it just depends on the issue, but spines almost always needs at least a CT scan or MRI. But we like updated imaging within 12 months, or if there's been a change in symptoms, we like to get new imaging so we can kind of have a good conversation about what's going on structurally, so that we can develop the right treatment plan, the right candidacy, the right chance for success, so we all feel educated on what the potential is. So with that, I don't see anything new here. I will let you guys enjoy the rest of your evening. I appreciate your time and listening to me talk and rant for the last 50 minutes. Again, thank you so much for joining and spending an hour of your time with me. I hope you guys enjoy the rest of your evening. Thank you.